Hello there. This is yet again another session. We are Med Expo Africa, and we are having a Med Expo that is going to take place at Uma Showgrounds Lugogo from the 7th to the 9th of September. But since we're having a health literacy campaign, we decided we should come with some interesting topics to discuss to the public and, share questions. So today we shall be talking about boosting the immune system. So with me here, we have Dr. Fiona.
Yeah.
I think she will tell us something. Yes.
Hi, everyone. I'm called Dr. Fiona. I'm so excited to have this conversation because I feel like when we had COVID-19, the pandemic, the conversation around boosting the immunity was everywhere. Everyone became a mini doctor. Everyone was creating concoctions. And that's why I think this is a very necessary conversation in this health literacy campaign.
True. So what is immunity in simple terms?
Immunity in the simplest terms is simply how your body protects you from infection. So when maybe these things get into your body that germs, your body is going to respond by trying to fight them off. But even in your body has to be in some kind of balance. It shouldn't overfight, because you also had during COVID, they were saying that sometimes your body is the one that's trying to kill you. So your body shouldn't overfight, shouldn't underfight. It should be some kind of balance to enable you to live healthy.
Yes.
Yeah.
And when we're talking about boosting the immune system, it's a bit of interesting term, because we can't, how do we boost? We have to just enhance the immune system.
Because when we say boosting, someone will think, if I go to the pharmacy and I buy a vitamin C, I buy like so much of it, and then some people even end up misusing drugs because they think there's a miracle pill, one thing that you can take to boost your immunity, and yet it's a system. So many things come into play.
Balance and harmony, like you said.
So it's not just one thing.
And our body is doing a pretty good job.
And also, like I said earlier, your body needs to be in balance. So you don't have to overdo anything, just in moderation.
Yeah, so our body is, like I said, doing a pretty good job. We have systems in our stomach, we have systems in our intestines, we have, the tears, really, they help with
even the skin is protecting you.
So we're just enhancing it. And if we talk about enhancing, now that we have changed our terms to a more appropriate term, what can we do? What are the methods we can do to actually enhance our immunity, Dr.
Some
Fiona?
of the things we can look at is the lifestyle modification, because there are so many things we do on a regular that actually affect our immunity, somehow lower it. And so if we modify those elements, we can actually have our bodies in position to better support us in case these germs come into our body. And one of the things we can look at is smoking, cessation of smoking. And when you're looking at smoking, it's not just the person taking the cigarette, even you that's inhaling this smoke, you're actually putting yourself in harm's way. So you have to make sure that even when you're in public places, make sure you're not in those areas that smoking is accepted, because you're going to take in, and smoke has a chemical that's called nicotine that lowers your immunity. So it's one of the things you can consider in your lifestyle modification.
So basically, when you're talking about lifestyle, it's just you, the person, and what you can change. Because when we look at bad habits, like you said, we have smoking, we have alcohol, we have excessive eating that can get you more obese, and you're at risk of so many things, like, the diabetes, the hypertension, all that. But then when we're really going to what we can change, we talk about the diet. So, Dr. Fiona, do you want to add something on the diet?
When it comes to diet, diet also, there's a lot of misconceptions when it comes to diet, because most people think we just have to eliminate certain foods entirely from the diet.
Like the no sugar.
Like, don't take sugar, don't take carbohydrates. Carbohydrates are bad. And yet you need the energy for your body to function. You need the protein. So it has to be a balanced diet. Like we've been talking about when we were young, you need a balanced
diet.
Remember
those things, body-building foods, body-growing foods. So you're actually growing, you're building when you're young, so you actually need this.
So you need everything to come in harmony and work for you. So you need the protein, you need the carbohydrates, but in moderation.
Like we said, balance.
You're not eating anything too much and not too little. And make sure that everything is featured in your meal. Yeah.
So let's talk about the vegetables, the whole foods compared to the junk. Because we keep saying
everyone wants to eat chips and chicken,
but we like the burgers, we like the pizza.
So when we're looking at like whole versus processed foods, of course it's better for you to eat the whole foods because in the process of processing these foods, they're eliminating some things. You know, maybe for example, you want to have white posho. They've removed the husks of these, like of the maize. So, and also people like to talk about blended juice versus eating the fruit. You know, of course, eating the fruit might be better because when you blend, you're over-sieving, you're removing any other thing, and yet you probably need the rough edges. You need all those components to come into place.
And then the prolonged boiling of vegetables. Yes, sometimes the whole components that we actually are, you know. So let's even talk about the vegetables having some folic, having some iron, which vitamins, yes, which help in, some of them help in manufacturing cells in our bodies that fight, manufacturing the soldiers in our bodies that fight.
The important soldiers that you need.
And then it also helps with the low blood levels, so we help.
You need more blood to be able to even circulate these things to the rest of your body. So if you're supporting yourself in that area, then you're also able to do
And we also talk about diet in the place that these cells need. They also need something. They need to eat. They need to be. Let me use it in a simple way. Because our body is a whole, it's a system. Us eating helps all our cells. So we have soldiers that are fighting for us. That's why when we bring up the malnutrition
in children, especially. Because when you see children that are malnourished, they'll have skin infections, they'll have so many. In fact, they'll get a small infection that can treat them very badly because their body is already compromised. It's trying to survive because it's not eating well. So now that's why it's very important for us to also talk more about malnutrition in children. What should the people do and what shouldn't they do when it comes to the health of the children.
And what do they need? Because you see, sometimes after 6 months, we're okay with exclusive breastfeeding. But after that, now we are introducing the diet. Why? Because the child is having more demands. Your breast milk can't give. And some people continue with the milk, 7 months, 8 months. And then you see the child is weak, has low weight, and you're like, what have we been feeding?
And breast milk is important, because you know, breast milk has all these things inside it that are going to support your body, because you give the cells to the child, and they're able also to support the preformed cells, you know. And so they support the body, they help the body.
Soldiers,
you know, they're like soldiers.
Transfer from the breast milk to the baby and help the baby.
And so the child will not get things like common cold or flu. They'll be supported. But like Dr. Rachel talked about, we're supposed to reach a point and the child now has more demands. So support them. Diet is really important.
Diet. We would even spend the whole day talking about this, but yes, diet is indeed important. Yes. So apart from, we've talked about diet, we've talked about changing our lifestyles, like the smoking, the alcohol, because for some reason, people who drink so much tend to forget to eat also, so the malnutrition comes into play. So exercise. Now tell me about exercise, because we're starting to see people making bodies.
Exercise is so important.
And what does it do?
Because one, already exercise is contributing to a healthy person. So if you're healthy overall, you're more likely to also have a supported immunity. But also as you exercise, you're increasing the speed at which the blood is moving around the body. It's distributing all these important nutrients to the different parts where it's required. So it just, at the end of the day, it helps you enhance your immunity because, and also exercise helps with your mind.
And
because
the weight,
we know,
it's also shedding off weight.
Because when it comes to the mind, we also go to stress now.
Now stress.
When you're stressed, there's so much happening in your body, and naturally, with the way life is set, you're bound to be stressed. So much is happening. You know, you're a parent, you're a worker, you're an employee, so much is happening. But then you have to moderate your stress levels, because when you're stressed, your body is producing a stress chemical. And this chemical lowers your immune system. So it means that you have to look at ways to moderate your stress, go out,
that
talk
even
to
takes
friends
me
and
to
family.
sleep, you know. Sleep. Because also sleep helps with your immune system. Yes. Sleep helps reduce that stress hormone that she has talked about, because it tends to lower your immunity. And also there is regeneration, release of those more soldiers in the body to actually fight for you. So you really need to sleep if you're stressed out. And she said, social life, have a social life. Go talk to your friends. Talk to your friends. You need to rant, talk. Go to your psychiatrist. Therapy has worked for people.
Yes, it has.
Like the saying says, a joyful person. Really, get sick, be happy.
So Dr. Rachel, can we talk a bit about herbal medication, because that's something else that came out during COVID.
Yes.
Everyone was talking about herbal medication.
And
everyone,
and everything like that.
So what is it about them? Should they take the herbal medication?
So when we're talking about herbal, most times there is like a form of supportive management when we come to maybe viral infections or something like that. But most herbs are gotten from places that we do not understand. And when we're talking about medicines are poisons. Yes, not like in a certain dosage or moderation. Now, I think in COVID, people were like, no, these things are crazy. Like, we have to drink as much as possible. So you're taking more than 3 cups, more than 4 cups of the concoctions, and we don't know how much dosage you're getting. It could be a dosage that causes a poison. Yes.
And also, sometimes we do not know the active ingredients in this concoction.
Most of them are not studied.
Most of them are not studied. And we're not saying that they are bad, because a lot of medicine has come from herbs.
Yes.
But when medicine is given to you, it's studied. They've done studies on different kinds of people.
How much dose you need, for what age, young kids have less than us.
So when it comes to, just because it's green doesn't mean it's healthy or that it's going to boost your immunity.
So let's now also talk about this drinking of water. People like hydrate. It's good for skin, good for hair growth, good for immunity. Do you have something to add on that?
Hydration generally is also good for your health as a person, but also the water in itself, it helps you, because your body, your kidneys need to flush out these harmful things, take them out of their body. And they use water because you're going to urinate, So the water helps remove those toxins, remove maybe the harmful bacteria, and in a way, it supports your immunity when you hydrate.
So let's add like the urinary tract infections. Most times we are telling people, drink as much as possible. And like you said, it clears, it keeps clearing. So drink as much as possible, because it's good for you. It's really good for you.
And also, one thing I feel like we need to talk about is vaccination. Vaccination. The Ministry of Health of Uganda has been telling you, make sure your vaccination and that of your child is up to date. So what is it? What are vaccines? What is it about vaccines?
Okay, so now I'm going to give a simple briefing, because we talked about vaccines, and we shall put the link in the bio for more information. So vaccines are killed or inactivated germs, organisms that we give to a patient to boost their immune system. It won't treat you. It won't treat you like the disease. No, it can't treat you or cause you death or whatsoever, all those myths that we have had. No, but it will boost your immunity. Your cells in the body, your soldiers that fight for you, will sense something interesting, create a response, so that the next time you're exposed to that exact thing, your body can be able to fight. So another way of enhancing is vaccination. Make sure you get your up to date, get your flu shots, get your COVID vaccine, which if you haven't.
And for women, make sure you're getting your tetanus
shots. Even men need those, because when they get cuts and accidents, so that it really helps also protect you from infections that would have caused you death.
So do you have anything else that you want to share with the people?
I'm just going to emphasize more that at the end of the day, when we're talking about enhancing the immune system, it is a system, not one part. Don't concentrate on one part. Concentrate on everything. Everything works together in harmony. Is your diet okay? Because you could be exercising, but you're smoking. But you're drinking alcohol, not in moderation. Yes. So at the end of the day, it will cause you issues. So balance. Have a balanced lifestyle. Exercise, sleep healthy, sleep enough, have enough hours for yourself.
Rest.
Yes. avoid stress, find ways of coping, managing your stress, you know, socially, talk to people, change environment, you know, we're different. Yes, but at the end of the day, don't work on one part and forget the other. If you're eating well, sleep well. If you're eating well, exercise well. Avoid those bad habits, and we're good to go with that.
I hope everyone has had. We're continuing the conversation in the comment section. Make sure you ask any questions in case you need clarity. And don't forget to like, share, subscribe. And do not miss the MedExpo.
MedExpo, 7th to 9th September. Yes.
We shall be there. Thank you so much.
Thank you.